Good morning, everyone. My name is Bharti Chauhan, and I'm working as an assistant professor in IIMT College of Pharmacy, Greater Noida. Today, I'll be delivering a video lecture on topic Angina Pectoris, asthma, and COPD. So, these are the contents for today's video lecture, in which we will discuss about the introduction, etiopathogenesis, clinical manifestation, pharmacological management, and non-pharmacological management of each disease. First of all, etiopathogenesis is nothing, is made up of two words, which are etiology and pathogenesis. About the disease, we should know what is the reason behind that and what is the process. Right. Third point is clinical manifestation is what are the symptoms that may occur due to that disease. Fourth is pharmacological management, or we can say the drugs that can do the treatment for the same. And fifth is non-pharmacological management without taking the drugs, how we can maintain our body or we can do the treatment, right? So first is angina pectoris. First, we should know what is ischemia. Ischemia is a condition in which the blood flow and thus oxygen is restricted or reduced in a part of the body. This will happen due to the obstruction or occlusion in the arteries, basically. Cardiac ischemia is basically we are talking about the heart, right? Is the name for decreased blood flow and oxygen to the heart muscle. Basically, this condition occurs due to the decrease in the oxygen supply and blood flow. Ischemic heart disease is defined as a lack of oxygen due to decrease or no blood flow to the myocardium muscle of the heart due to narrowing or obstruction of the coronary arteries. It is called coronary artery disease. So we can say ischemic heart disease is the imbalance between myocardial oxygen supply and demand. The basically coronary artery disease is of two type, right? First is angina and second is myocardial infection. The angina is a acute disease and myocardial infection we can say is a chronic type of disease. But today we will only discuss about the angina. The type, if we talk about the types of the angina pectoris, definition we have already discussed. You can say the angina is also called angina pectoris. There are basically three types: stable, unstable, and variant angina. So, first of all, what is stable angina? Stable angina is the most common form of angina. It usually happens during activity, exertion, goes away with rest or angina medication. Stable angina pain is predictable and usually similar to previous episodes of chest pain. Chest pain typically lasts a short time. It is not a long time of condition. It perhaps may remain for 5 minutes or less than 5 minutes. Basically, if we take the example, pain comes on when you're walking up in the hills or in cold weather, you can feel a pain in your chest. It may be due to the angina. So, stable angina is not a chronic type of condition, it is a acute condition. So, next is unstable angina, a medical emergency. Unstable angina is unpredictable and occurs at rest. Okay, what we have discussed stable angina is due to the exertion, and if you are doing any physical activities or you are riding on the uphills or doing the trekking, this will occurs. But in unstable angina, this condition is occurs at rest. It's typically severe and lasts longer than stable angina, maybe 20 minutes or longer. If the blood flow doesn't improve, the heart is starved of oxygen and heart attack occurs. Basically, or the angina pain is worsening and occurs with less physical efforts. The pain doesn't go away with rest or usual angina medication. Unstable angina is dangerous and required a severe emergency treatment. Next, last is variant angina. Variant angina, also called principal angina. isn't due to the coronary artery disease. Basically, this occurs due to the spasm in the coronary arteries. It caused, so let's take a look at the slide. It's caused by spasm in the heart artery that temporarily reduce blood flow. What happens if there is an, we can take an example of a simple pipe that we use at our homes, right? If we do the circulation motion to this, or we can tie a knot in the pipe, the flow will unfortunately will not be able to go to the other end, right? So the same condition will happen here. Due to the spasm, the blood flow will not be able to go throughout the heart. So severe chest pain is the main symptom of variant angina. Ultimately, chest pain will occur when there is a pressure build up on the front of the pipe and it doesn't able to go through that, right? It most often occurs in cycles, typically at rest and overnight. Same condition in the unstable angina that we have already discussed. The pain may be relieved by angina medication. Basically, variant angina is most common in women and uh, in peoples who do the smokings also. So we should not do the smoking. Next is etiopathogenesis. What is the reason behind that and the how this disease is occurring in our heart and how it happened? We should learn here. Right, there's a flow chart. First, what is atherosclerosis? You should know there is a term written here. Atherosclerosis is nothing. When a plaque is built up in your coronary arteries, right? There is a obstruction. Obstruction means रुकावट. रुकावट होने के बाद क्या हो रहा है आपके ब्लड फ्लो नहीं प्रॉपरली हो पा रहा है थ्रू आउट दी हार्ट. That is why there is a ischemia condition, and due to which there is a condition hypoxia will occur, which is a reduce in oxygen demand. Ultimately will occur the thrombolysis. Thrombolysis is when there is a buildup of plaque in the same area, but due to that, the obstruction of blood flow will occur and plaque rupture, causing acute occlusion of the artery by clot. Now, I have told you the two terms, right? Obstruction and occlusion. You may be little bit confused about that. Obstruction is nothing, it's just used for the hindrance. Hindrance, you can say in Hindi, rukavat. And occlusion is basically complete blocking, right? These are the two terms that you should know. Next reason is arterial spasm that I have discussed in variant angina. Sudden reversible obstruction will occur that results in ischemia and hypoxia, due to which oxygen demand will be reduced and ultimately causes the angina. Next reason is behind this disease is the combination of all. Atherosclerosis is also occurring, plaque split is also occurring, plaque is bursting, and due to which there is a there is blood clot is happening at the same reason, due to which occlusion is occurring. Occlusion is the blocking of the arterial area, artery, right? Due to which what is happening here is ischemia, and next same hypoxia will occur. Oxygen supply ultimately will be reduced and blood flow will be reduced. That will cause the angina. I hope this is clear. Next, we will discuss the clinical manifestation of the angina pectoris. Due to this condition, chest pain and discomfort may be seen in the patients. Pain may also be felt in the arms, neck, jaw, shoulder, or back. May feel like burning, fullness, pressure, squeezing throughout the chest. Other symptoms of angina include dizziness, dyspnea. Dyspnea is shortness of breath, and fatigue, nausea, shortness of breath, sweating, same. Now, if we talk about the non-pharmacological management of this disease, is how we can take precaution or how we can manage ourselves for prevention of this disease. We should do the counseling and education of patient. Right. Lifestyle modification will occur when you will stop doing the smoking or drinking. You will eat healthy food, right? Next is smoking, avoid alcohol intake, diet and nutrition, salt restriction is another factor that may be helpful for the management. Next is pharmacological management. What are the drugs that can do the treatment? Anti-anginal drugs are nitrates, nitroglycerin, isosorbide dinitrite, beta blockers, propranolol, metoprolol, and calcium channel blocker, verapamil, amlodipine, potassium channel opener, nicorandil, antiplatelet drugs, aspirin. Antiplatelet drugs, why we are taking here is because when there is a plaque accumulation at that area, the plaque ultimately will burst. After bursting, platelets will get deposit on that area and try to fill that area, right? And after a while, there is a clot formation in that area, and due to which occlusion will occur. So we do give the antiplatelet drugs to the patient for prevention of that condition. Statins are used for uh, hyperlipidemia, right? The statins are the class that we have seen in hyperlipidemia condition. Drugs that been used for this treatment, they decreases the lipid level. Okay, the drugs are atorvastatin, fluvastatin. Now, other than that, what is the other treatment that we can do for the angina pectoris? Is revascularization. Revascularization is you have heard about the angioplasty and stenting that should be considered if angina persists despite drug therapy. So there are basically two type of revascularization. First is percutaneous coronary intervention in which we insert a balloon, right, stent, and after inserting it make up the spaces and expanded, then balloon will be removed from the artery. Next is coronary artery bypass grafting, in which the bypass surgery is being taken place for the treatment of angina. Next disease is asthma. I think everyone has heard already about that disease. So this is the introduction. The word asthma is of Greek origin and means panting. Panting means half now. So Hippocrates used the word asthma to describe episodic shortness of breath. Asthma is a chronic inflammatory disease of the airway of the lungs. It is characterized by difficulty in breathing, wheezing, tightness in chest, coughing, airway obstruction. So if we talk about the definition of the asthma, it is a chronic long-term lung disease that inflames and narrows the airway, in which mucous membrane muscle layer of bronchi become thickened and mucus gland enlarged, reducing the airflow in the lower respiratory tract. Now, what are the types of asthma? First is extrinsic asthma, also known as allergic due to allergens like dust and pollen can also cause asthma attack. Intrinsic asthma is non-allergic asthma, mostly due to cold and stress. Adult onset asthma can start at any age, but it's more than 40 common in people younger than. Status asthma, long lasting asthma attacks need treatment. Exercise induced asthma, it happens during physical activity. Occupational asthma is affects people who work in chemical or dust area. That is occupational asthma. Next is etiopathogenesis of that. What is happening here is due to the exposure to stimuli allergen, right? Production of antibodies will occur, and after that, mast cell will get activated and release of vasoconstrictor inflammatory substance like histamine, leukotrienes, prostaglandin by mast cell, due to which enhanced mucus secretion will occur, airway will get narrow, and obstruction will occur. Obstruction is, I have already discussed about what does it mean, and due to which there is a precipitation of asthma. Other and the other reason or other process, it may be migration of phagocytic cell. Phagocytic are the phagocytosis that you have already heard about. Phagocytic cells are basically, if is a military of our body. What they do is, when an allergen enters in your body, they try to engulf it and try to destroy it so it cannot harm our body further. Right. So what is happening is migration of phagocytic cell, and after that phagocytosis process will occur, releases of basic lytic enzyme that will kill, and due to which further inflammation will occur and it worsens the conditions. Now, what is clinical manifestation? Clinical manifestation for asthma is wheezing, painless tightness in chest, shortness of breath, and difficulty in exhaling, coughing, dry persistent cough. Diagnosis, we can do the physical examination. And lung function test we can also perform. So spirometry is an instrument that measures how quickly the lungs fill and empty. Second, we can do the lung volume test. It shows how much air the lungs can hold. Mano test is fractional exhale nitric oxide test. The patient breathes into a machine that measures the level of nitric oxide in his breath, which is a sign of inflammation in the lungs, basically. So, non-pharmacological management, sports and physical activities are important for most people who have asthma. Regular physical activity should perform. It increases the uptake of oxygen and amount of air that is exhaled. And when you breathe out, people who are allergic to dust might be able to prevent allergic reaction by making various changes in their home. These include wiping the floor with a damp cloth, using mite-proof mattress cover. Basically, they are saying that you should maintain a proper hygienic area around yourself and mm, do the mattress washing of your bedding temperature above 55 degrees Celsius. You should do the washing at that temperature, and removing dust traps should, such as upholstered furniture and rugs. You should avoid smoking, first of all. All the coronary heart disease are due to the smoking and drinking, right? So smoking tobacco in any form can cause a number of medical conditions or make them worse. People with asthma have oversensitive airways, so it's particularly important for them to stop smoking or not start smoking in the first place, right? People with asthma can choose between many different breathing exercise and techniques. They do the anulom vilom that we all know about that, right? They are meant to have a generally relaxing effect and also help to maintain calm, controlled breathing during asthma attacks. Next is last disease is chronic obstructive pulmonary disease, COPD, right? So what is COPD is constructive chronic obstructive pulmonary disease is a chronic inflammation lung disease. It is not acute, right? It is chronic. This means that the disease is very dangerous or maybe life-threatening. So that causes obstructed airflow from the lungs. According to WHO, a lung disease characterized by chronic obstruction of lung airflow that interferes with normal breathing and is not fully reversible is termed COPD. First of all, what we have learned here is this is a chronic condition and it is not fully reversible. Okay, so uh, this is the etiopathogenesis of the disease. What is happening here is there are three conditions that can cause COPD: asthma, chronic bronchitis, and emphysema. Chronic bronchitis is the inflammation in bronchi, and emphysema is the alveoli. We all know alveoli, right? Lungs. In here, you can see there's a structure of lung, and at the end there is a small glomerulus globules, right? They are called alveoli, in which the carbon dioxide and oxygen gas will get exchanged. Okay. So, group of lung disease that block airflow, damage lung, and cause difficulty to breathe. First is asthma. Asthma, I've already discussed. What is happening here is the activation of uh, mast cell will release some chemical compound like histamine, prostaglandin, and leukotrienes, due to which a phagocytosis process will occur, or other hand, there's a inflammation will occur, right? Due to which there's a bronchial constriction. Next condition is chronic bronchitis. Due to coughing, mucus will release to the allergen, and bronchial tube will get inflamed, due to which this condition will occur. And here, last condition, emphysema. Emphysema will occur due to the inflammation of alveoli. There is not a proper exchange is happening of carbon dioxide and oxygen, due to which it may be due to the holes will occur in alveoli, or it may lose its elasticity to exchange to do the process. And the conditions due to which it occur are smoking and macrophages, proteolytic enzyme will release, and the lung tissue will get damaged ultimately and cause the chronic obstructive pulmonary diseases. So this is the image. You can see here the lung at the left hand side is looking red and is healthy, and at the right side inflamed. So inflammation, after inflammation, the bronchi will get narrowed, and due to which there is not a proper exchange of carbon dioxide and oxygen gases. Here you can see emphysema, I have already told you, in which a normal alveoli is looking like that, and alveoli with emphysema will look like this, damaged alveoli. This is the etiopathogenesis of the COPD, and now we will talk about the clinical manifestation. At first, you may have no symptom or only mild symptom. As the disease gets worse, your symptoms usually become more severe. They can include frequent coughing, a cough that produces a lot of mucus, wheezing, lack of energy, whistling or squeaky sound when you breathe. जैसे सीटी जैसी आवाज आती है जैसे हम सांस लेते हैं. Shortness of breath, especially with physical activities, tightness in your chest. Some people with COPD get frequent respiratory infections such as cold and flu. In severe cases, COPD can cause weight loss, weakness in your lower muscle, and swelling in your ankle, feet, or legs. Non-pharmacological management is smoking. You should avoid cessation of smoking, right? I have already told you throughout the video lecture that smoking and drinking should be inhibited and should not be done if you want to avoid these diseases. So, oxygen therapy you can choose is frequently provided along with pharmacological intervention to treat underlying hypoxemia in COPD patient. Vaccination, all patients with COPD should be given annual influenza vaccination. Pulmonary rehabilitation or pulmonary rehabilitating program you can join as for the drug treatment to improve physical function, or you can do exercise, education, counseling, and behavioral intervention. So for pharmacological management, there are various types of drugs that that can be used in COPD. First are inhalation methods, anticholinergic. We can use short acting ipratropium and tiotropium, aclidinium, beta-adrenergic drug short acting as is albuterol, pirbitrol, salmeterol, and corticosteroids are beclomethasone, fluticasone, So these are the steroids that you can be used for the treatment for COPD. And in combination of both beta adrenergic agent and corticosteroids, we can use salmeterol and fluticasone, no, fluticasone as a combination. And triple combination, we can also use anticholinergic, beta adrenergic, and corticosteroids. Other than that, there are systemic administration of antibiotic, antioxidant, biological antibacterial drugs, or anti-inflammatory. So this is all about today's lecture. Thank you so much for patiently listening throughout the video lecture.